I think for the health sector, we have really been affected positively and negatively by the pandemic and by the shift towards digital technologies. One, I would talk about the positives. So the positives have included innovations around products or platforms where the interface between the doctor and the patient have been transformed from a face-to-face towards an online visibility. The other positive is, of course, protecting the healthcare worker. So the more the healthcare worker is exposed to a physical patient, the more they are, exposing themselves towards the risk of getting infected, or even vice versa. So it's not always the patient to the health worker, but health worker to the patient. So that has, the fact that you're reducing the physical interface has helped towards reducing the potential number of infections within the healthcare setups. The other thing is, of course, automating processes. So this is something we're very used to, paper-based kind of, not taking or referrals. And now when things have gone into a platform, it's easier to do, at the touch of a button, you're able to access some of these records. On the negative side, of course, we have people who still believe in a face-to-face interaction from a psychological point of view. So someone wants to say, I really need to see Dr. So-and-so, or I really need to be attended by this particular health worker. We also have on the healthcare side where there are some processes and procedures that really need the physical touch. For example, if you need a laboratory procedure, you still need someone to come and draw the blood. If you need a radiological procedure. So there are things that where the reduction in face-to-face will not be eliminated, but then you still have so many of those processes that can still be automated. For example, just the collection of the blood can be physical, but actually getting the results back or getting the results sent to your provider, all those can be on a platform. So we've seen a very rapid transformation, as my colleague Wambui has said. It's been out of force, and I think it's a positive thing, because the health sector, for the 15 or so years I've been working in this space, have been one of the least towards in terms of adopting to technology, and now we are all adopting to this technology. In terms of the innovations around digital spaces, so for example, the Ponea Health app, it allows you to schedule a doctor's meeting or a healthcare worker's visit. It allows you, so you're able to space out, even the healthcare provider is able to space out the visits, so that you're all not just crowding and going, pick a tab at the counter and wait for your turn. And that helps in reducing the social distance, that in increasing the social distance that is recommended by COVID-19. It also allows the health worker to actually come to your home for the services that have been regulated and vetted, and there are many. Nowadays, the regulators have allowed, and to a certain extent, certain services to be provided at the home setting. I will especially mention certain fragile populations who, for all intents and purposes, should not be exposed to settings like a hospital setting where the risk of contracting some of these infections are. For example, our elderly population, our pregnant women, people with chronic illnesses. We then have, through the platform, you are able to dial a doctor or dial a nurse or dial a laboratory service, and these services are able to be provided for at home. So as long as you have access to a smartphone, download or able to access the Ponea Health platform and dial the numbers that you'd want to do so. So I think we are seeing a lot of this new field in medicine, which is home-based care, that wasn't there before to the same extent before COVID.
On my way here, there was a conversation on radio in the morning, and the conversation was around how and Dr. Wale, you can say whether this is real or not, how there seems to be not many people in hospitals for everything else other than COVID. And a lot of the people calling in were saying, yeah, so now I just call somebody and they prescribe whatever it is I feel I need based on the symptoms. So I think I would be very receptive. On a personal note, I have a thing about hospitals. So I'm borderline, I think, hypertensive, I keep saying. So if you tell me just the routine, they're called triage checks, just the sight of that BP machine usually spikes my BP. And then I'll say, give me a few minutes and then let's take it again. So if I can avoid the pressure that comes with having to go to a hospital, why not? It's not really, especially if you're getting it off a reliable system, that you know, for example, Ponea, that the doctors that you get are vetted, are qualified, you would actually have no issue, and I would definitely have no issue with it. Again, as long as you know that the regulation behind how it is being done is ticked off by the right people, I think it's something that has also quite picked up. From a consumer, I definitely have no issue. I think it's something to be encouraged. One of the reasons I imagine that people go to hospital less now has everything to do with, we've also kind of brought back hygiene that we used to have, that we lost. And the realization that I don't need to run to hospital every time I cough or every time I have a stomachache. And maybe there's also uptake of home remedies, healthier eating. So I think the home-based has a lot of advantages. It shields you from exposure to any other disease that can be picked up from a hospital outside COVID. I think there are some that could happen like that. So I think it's to be encouraged, and definitely the right way to go for consumers. We keep saying we don't have enough hospital facilities. So unless I need to go in, I should be encouraged not to go in.
I want to add, I think in terms of our setup, even as a health system, we are moving towards the Cuban model of providing healthcare services, which is household-based. So if you look at the structure currently, we have people going, so you and I, if you're coming from a family, let's say of 2 parents and 2 children, the mother would go maybe for a gynecological visit to the hospital, and then maybe the next week the child will be unwell and they have to go and see a pediatrician. The man rarely gets sick, but just in case, or if they get sick, they rarely go to hospital. But with the household setup is that you have a primary healthcare, a primary physician who's ascribed to certain households. And so they do the home visits, even just for routine checkups. You don't need to be sick to be seen by a doctor or to be seen by a healthcare provider. It can be just nutritional counseling. It can be just a wellness checkup. So in a home setting, you're able to see, there are things we call social determinants of health, which say, for example, this person keeps on coming to you with a cough, and you keep on treating it, it's not getting better. But when you visit them in their home setup, you're able to see maybe they live in a house, in a structure, in a house that is, you know, very poor ventilation, or they have a thick carpet that's rarely, you know, vacuumed or cleaned, or they have pets around them that's triggering some of these conditions. So home visits give you that added advantage of seeing beyond the disease that has been presented to your clinic, because many of these things, the support structure or the environment, the ecosystem around that particular patient really determine how they respond to your management or what other issues they present with. Yeah. So I'll speak briefly about the e-commerce space with regards to digital health, and specifically on the Ponea Health platform. So the Ponea Health platform has various interfaces. So there's the healthcare providers interface, which is where we are able to support the healthcare worker to plan for visits. Yeah, so a patient or a consumer is able to book appointments through the app to see the healthcare worker. A consumer is able to order for a service like a laboratory service or pharmaceutical supply, basically ordering for drugs and stuff like that. So from the provider side, one is able to have a lot more information and organize their clients or their patients in a good way. They're also able to even give feedback through the system to the client and say, okay, we booked you for this particular time. I'm not available, something has come up, but I can either refer you to, if it's maybe a group practice, to another doctor, or I can reschedule this. So all this is through the system. The system also helps the healthcare provider to follow up on the financial side, the accounting side. So it's able to track. I think I know of many colleagues who, because we are very well trained in the healthcare side, we are not very good managers on our accounts or our books. So this system is able to sort a lot of that. It's also able to keep records. So before you start flipping notes, you're able at the touch of a button to realize, okay, this patient or this client has not come for this particular time. Can I send a reminder that you're overdue, or those kind of scheduling functionality. On the consumer side, you have, at the touch of a button, you are able to pick, you're able to key in maybe the kind of condition that you have, and the system is able to tell you, based on this kind of symptoms that you've keyed in, these are the preferred, or these are the most likely specialists you need to see. And then they give you a rundown of the specialists who are on our platform. You're able to select one who's closest to you or more convenient. You're able to schedule according to time. You're able to reschedule if given enough time on that. And you're able to use the same data with another provider. So you don't have to keep on remembering, oh, I was using this product. I can't remember, there were blue pills, I was taking them 3 times a day. So all this is information that the platform is able to support the system with. And then we have the system where you're just giving information, content. So we are able to send or to push information about, maybe there's a latest COVID-19 update from the Ministry of Health, or we are able to tell you if you have hypertension, have you done this and that, the exercises. So there are also these promotional messages that you're able to get that promotes your health and well-being towards improving your lifestyle. And then there are many other functions that we are intending to bring on board. We hope that in the next phase, which is phase 2 of the product implementation, we'll bring in the providers, insurance providers, and we're already talking to a number of them. We are going to bring in an e-wallet where you're able to save specifically for healthcare needs. So that e-wallet locks those savings towards only the provision or payment for healthcare for the health spaces. And we are able to do a couple more functions, and we hope that when you visit our website, www.ponea.com, there's a lot more information that you can access, and just check out what else you can do on that platform. Thank you.
I would say, as we are speaking about going online, one of the things that we would really love to see would be, a lot of us have elderly parents who live perhaps up country. And in most cases, you either need to buy medicine here and transport it to wherever it is they live. At the same time, you might not be in the position to, and you'd want to be able to traditionally identify a chemist near them so that they can go there and buy, but you're not quite sure what kind of medical, what drugs they have available in their locality. So it would be good to see whether Ponea can come up with packages where either ourselves seated in the urban areas or siblings or relatives in countries outside Kenya be able to procure on our behalf that medicine and send it straight out to the person, or provide an opportunity for our parents to be able to have access to the right medicine at the right time, to have the right medical person attend to them at the right time and conveniently. And one of the things I have experienced is that the elderly don't necessarily like going to hospital, So if it is scheduled in such a way that they can't get out of it, and that would be something that we'll be looking to see if Ponea can do, that if the appointment is for Tuesday 9, the provider simply appears on Tuesday 9, and the parent has no option but to be attended to. So we'd want to see packages that help us help people who are not within our locality, whether we are seated in Nairobi or seated in Mombasa or seated in the US, be able to provide medical care to our parents at any part of the country in a timely manner.
Wambui, it's interesting that you say that, because the Ponea app has a functionality called the diaspora functionality, where anyone who wants to provide some system through which their dependents are able to access care can save through an e-wallet within the system, and anytime the dependents would require to access services, they don't have to call you up, they just have to use the platform, and whatever resources that have been saved through it are then freed up towards those services. So it gives a certain peace of mind. It also allows you to plan, because you can say every month I'll be depositing this amount of service. So it's a security, it's an insurance actually. So that's it's available for us through the Ponea app.
I would add that I feel that there's a need to reach out a bit more to the public to understand the systems that exist. So it would be good to actually give it a bit more publicity. It sounds like an awesome product that will benefit a lot of people. So you need to be a bit more out there in the media so that we are able to reach as many people, to make them understand that they have this opportunity to get treatment or provide treatment for their loved ones through the Ponea system.
My last comment is our tagline is "It works." So the Ponea system works. I would encourage you to visit our website, www.ponea.com, and tell us whether our tagline is right or wrong. But we are looking forward towards enlisting you as a provider, enlisting you as a consumer, and shaping the future of healthcare, which is technology right now.